Well, welcome, folks. We're going to go ahead and get started. My name is Jerry Abel with Education Northwest, and we're providing the technical support for this webinar. We're hoping that Lily can join us as soon as she is able to resolve her technical difficulties, so hopefully she'll be able to join us. So this is the Data Collection and Monitoring and Troubleshooting webinar. If you could advance to the next slide. We have the lines muted upon entry, but we do have the ability to unmute individual lines should you have a question. So there is a raised hand feature located to the right underneath the participant panel. You can also submit questions by sending us a chat. Do it to all participants so that we're aware of what's being asked. So with that, I'll turn it over to Nicole and enjoy the webinar.
Thanks, Jerry Ann. In lieu of Lily, I'm going to give a brief introduction to today's webinar. Today we're going to talk about data collection, monitoring, and troubleshooting, and specifically troubleshooting for data collection, monitoring, and reporting issues. And really what we wanted to do is bring some issues that we have been seeing as we've been working with all of you out there in the field over the past couple of years, and particularly as we're starting to read through reports and to get input from people as they're in the midst of their evaluation plans, about some of the problems that people have and some of the really creative solutions that they've found to solving those problems and really moving forward with successful evaluation plans. So with that being said, I'd like to turn it over to Peter Lovegrove, who is our presenter for today, who's going to talk you through some of the things that we've seen and talked about.
Hi, thanks, Nicole, for that introduction. As Nicole said, really the crux of this session is to highlight the aspects of SIF evaluation projects that, in our experience as we're going through SEPs and reports over the last few years, what things are really important to monitor and troubleshoot, not necessarily to ensure success in terms of finding positive program impacts, but in conducting a study with the strongest internal and external validity possible. And also delivering a study that can provide as much helpful information for both you, your program, and other programs moving forward. Just to give you an overview of where we're going today, I'd like to start by talking about the various aspects that might be monitored and subject to troubleshooting across a SIF project. In part two, I'll sort of then burrow down into 4 specific aspects of SIF projects that we think can be key components of an evaluation success. Again, taken from our experience of seeing certain challenges repeatedly and then sort of having our own opinions and seeing what other people are doing about the best ways to address those. The focus in that second part is largely on internal and external validity, and thus on the key threats to the levels of evidence, as opposed to program rollout and implementation. In part 3, then, I'd like to turn to reporting because there's been lots of discussion recently about what should be included in reports. And just in a sort of a weird twist of the title there, CNCS and JBS uses the reports for internal monitoring and potential troubleshooting. And we also collect data out of the reports, so that's fine. But there's been questions about how reports should be approached and structured when there are specific issues like having no significant or positive results, having mixed results, and when there are circumstances that mean that the internal and external validity of the study is lower than planned. So how should those programs be structured and approached under those circumstances? So with that overview, I'd like to briefly describe the different aspects of a project that may need to be monitored. So this diagram here is intended to display both the aspects of a SIF project that need to be monitored, as well as the questions one should ask. In other words, what information would be most useful. Starting in the middle, I'm sure we're all attracted by the red center square circle there. I think these are the best monitoring questions to ask. So what is the status of the current project? What's happening? Number 2, how does what's happening align with the subgrantee evaluation plan or the SEP? Are there any changes from what was intended that are going to impact the final level of evidence? Okay, It's a really important piece. Third, what lessons are being learned in terms of how the program or evaluation will operate in the future, or that other programs outside of the SIF or other evaluations outside of SIF might be implemented in the future. To sort of draw out, so those are the central questions. And I kind of wanted to give you sort of a sense of what the aspects of a SIF project might be that you would want to ask these questions of. Okay, so listed at the top in that larger gray circle, you have sort of the overall program and project implementation. So aspects of the program are really, really important to monitor: the enrollment, how the program is organized, the theory of change, the target population, who the stakeholders are, et cetera, et cetera, et cetera. On the other end, at the bottom side of that circle, these are still related to sort of the all-encompassing program and project implementation. They're really important aspects of feasibility, things like the timeline, budget, staffing and personnel, and IRB approval. I think all of these different aspects really encompass the implementation study and the impact study, which are themselves interrelated in terms of the information they provide and the means by which they're conducted. So that's why I had them kind of overlapping in the middle there. Moving to the next slide. I wanted to reiterate quickly that the key map and structure for the monitoring and troubleshooting from our perspective definitely is always going to be the SEP and the SEP guidance. Various implementation, data collection, and evaluation study challenges may emerge at different times during the SIF project, or they may change over time during the SIF project. And so continuous monitoring by grantees, sub-grantees, and evaluators is definitely required. And then the key question that JBS and CNCS will be asking in their monitoring and troubleshooting will be, how does the project currently align with the SEP? Is it on track? And what does this mean for the final level of evidence? I know you're all on mute, so feel free to ask. If you have any questions throughout the webinar, please feel free, like Jerry said, to ask questions. But I'll definitely pause at the end of every section to ask if there are any questions. Does anyone have any questions either over the phone or on chat about that sort of quick overview there?
Peter?
Yeah, it looks like Carrie has,
yeah, hi. I'm just wondering if we're going to be able to get a copy of the PowerPoint emailed to us after the webinar.
Surely. The slides in the recording will go up on the Knowledge Network, which, I'm sorry, I don't know if you're a sub-grantee or grantee if you have access to that, but definitely my email address is, I can send you that. If you put your email in the chat feature, I could send you the slides over email very easily, and just at the very end of the
Peter, can you hear me?
I can, yes.
Yeah.
Hi, Lily.
Hi, Lily.
Hi. Hi, everyone. I apologize. I had some technical difficulties getting on. But thank you for that question. And, you know, you can also send me an email, and I'd be happy to send you the PowerPoint.
So yes, we can. The short answer is yes, we can certainly make arrangements for everyone to receive copies of the PowerPoint who would like one. It will be posted to the Knowledge Network as a recording with all the audio to it, but if you don't have access to that, then we can make arrangements to get you the PowerPoint.
Okay, great. Are there any other questions? Okay, all right, great. So hearing none, I'll move on. Next, I wanted to cover 4 specific aspects of an evaluation study that have emerged as themes, aspects of a project that have been evaluation challenges for multiple sub-grantees. These aspects are recruitment and retention, human subjects or IRB issues, data collection, and with that third bullet, I should say primary data collection, as well as the 4th bullet there, the use of secondary or administrative data. In this section, I'll talk about why these things are central to a SIF evaluation project, how they can be challenging, and share some tips for helping evaluation projects to complete successfully. So first up, I'd like to talk about recruitment and retention in an evaluation study. who you collect data from and who you collect data from over time are key aspects of it for internal and external validity. Internal validity is substantially threatened when there are large amounts of differential participation and attrition once a study has begun. These terms refer to the fact that program participants enroll or drop out of the study at significantly different rates compared to non-program participants. And this is a problem because your evaluation study will be designed to compare groups that were as similar as possible. And because these groups, once they're set up, they agree to be part of the study at different rates or are leaving the study at faster or slower rates, when you compare those two groups at the end of your data collection, there are now some really important differences between the two. The characteristics and the context of the two groups are going to be different, and so you can no longer make that coveted assertion that all things were equal except for the program participation when you compared the program and the non-program groups. Another sort of additional issues, lower recruitment and retention can lead to having too few cases to reliably make estimates. And that's otherwise known as having low statistical power. And when you have low statistical power, that can restrict things like the type of analysis you can run or the number of control variables you can use. So it restricts the amount of selection bias that you might be able to take account of. Lastly, the more missing data you have, the more complex it will be to use statistical techniques to include some of those cases with some missing data. Your estimates might be erratic, or your models might not successfully run. In terms of external validity, problems with recruitment can limit the population to whom your results can be generalized. We've seen this at the site, center, or district level. Originally, projects have targeted strong evidence because they propose studying students or participants in multiple districts across a region, across multiple states. And then ultimately, they're only successful in getting the program or evaluation study rolled out in a single site, and so then their external validity is limited such that they slip back to moderate evidence. So the next slide. So what are some recruitment and retention challenges to maybe consider? On the participant end, getting consent, informed consent, particularly active consent, is one that pops up frequently. Other than simply getting consent forms signed, one particular factor that potential participants may be concerned about how data may be used and for how long it's going to be used. So sometimes data are collected over a very long period of time, and they're reported on for several years. When these things are things like school records or job history, participants may fear being stigmatized, so that the data collection will somehow hinder their success and follow them around for a long period of time in the future. Mobile and hard-to-serve populations are a big challenge for SIF studies. Collecting data on people who move around is persistently a challenge. Just finding out where people are to have them participate in the study is difficult. And you may be serving people who are reluctant to be involved in something feeling very federal or official in the first place. There are some SIF projects who are serving newly immigrated and recently incarcerated people. So those are two examples of potential participants fitting into that category. And I think reluctance about the collection and then sort of mobility are key determinants of both recruitment and retention issues. Being a little tricky on you, I did want to expand the definition of recruitment and retention to program staff as well and project staff, because there's been multiple programs using volunteers to deliver services, and these volunteers have ultimately been hard to recruit from communities, and that's created difficulties for the program operations as well as then consequently the evaluation. Communities are often being served for the exact reason that makes that recruitment is difficult. The community has some really important needs that need addressing. Okay. So moving on from volunteers and talking about staff generally, retention of staff can be a challenge. So program participation, completion, quality, satisfaction, fidelity can all be affected when staff are constantly being removed and need to be replaced. There's one SIF program in a report, this program was a reading program, and they mentioned in their progress reports that students and parents had mentioned to them during interviews that they were less satisfied with the program than they might have been because they had an original tutor who the child worked with for a while, and then that tutor left. And then the replacement tutor was somebody who the child felt less attached with and who taught the material slightly differently. So there was sort of a disconnect or a breakage there that was kind of difficult. So recruitment of program staff in that way, in terms of getting volunteers and retaining staff, are two particular challenges that I've noticed as we go through the report. So what are some tips that we have to provide to either address or avoid these challenges? First, I think some study designs can be used when recruitment participation are a concern. More willingness to participate is often cited when selecting quasi-experimental design as opposed to a randomized design. Sometimes people are just reluctant to participate in a randomized trial, and so when you have a quasi-experimental design, those concerns might be mitigated. But within a randomized control, designs such as randomized encouragement, where you have a list of potential program participants and you randomly decide who you're going to encourage to participate, or a system where you provide base services to everyone and then randomly select your treatment and comparison groups into those who receive more intensive services versus those who receive less intense, just those base services. Okay. So those are just study designs, just to recap that point quickly. Those are study designs that can be used to specifically try and bolster participation and retention. Participant communications such as newsletters or open office hours and regular checking in are really important, I think. A program I worked on in grad school used newsletters and consistent updates, as well as checking in to make sure that the participants were still happy participating in the study. We're a big part of retaining 80-odd% of participants across a 30-year study period, I think, which is pretty impressive. I think making participation easier, perhaps using decentralized or cost-effective means like online surveys and text messages might be useful. But honestly, sometimes I think it's easy to send somebody out to collect the data as well. It depends on what's easier for whom in what situation. I think trying to find means of passive consent is relatively easy and convenient, and definitely boosts his participation rate if it can be, if it's at all possible. My perception is that passive consent is very, very difficult and rare thing to attain, especially with vulnerable populations and students. But if it's something that's possible, then that's fantastic. I think tracking and follow-up of the sample and communication of participant rates and retention rates to all stakeholders, I think, is very important for reminding everybody to address this particular issue when they can. And hopefully will, by having a number and targets, will boost sort of performance in this matter and hopefully build a buy-in as well. And I think that buy-in will be maximized if you have as many stakeholder advocates for recruitment and retention as possible. So as far as school programs, you might have principals, teachers, superintendents, SROs, counselors, program staff, and admin, everyone banging on the recruitment and retention drum to make this aspect of program as successful as possible. I definitely think that's it's a really key point, and it's so key for internal validity that it's worth sort of trying to drum up that support. I think, lastly, trying to find an evaluator an evaluation staff who are ready and excited to use missing data techniques, I think is really a plus. Excitement about any techniques is always a plus from your evaluator and even program staff and everything. But there are some really some good techniques out there, given a little expertise and experience with them, to avoid using list-wise deletion. So if you use list-wise deletion, that's a process by which you just, if any participant has any missing data, you exclude them completely from the analysis. And when you do that, you end up with you can end up with a biased sense of what the program impact was. And so these missing data techniques, it allows participants who have some missing data to be included in the analysis. And conceptually, theoretically, and demonstrably, that leads to less biased results. So I think it's kind of important. Okay. Before I move on to subjects, And I'm glad somebody noticed my my focus on Minnesota. I had a map, a global map, and then I want to focus in. I didn't want to put attention on Minnesota necessarily on it. Although maybe it's worth it. Okay. Hearing no questions at this point. IRBs, which I'll call it, Internal Review Boards, Human Subjects Review, those are all the same terms. They all mean the same thing. And IRBs are an issue that we've had to provide assistance and guidance with, so we wanted to discuss it here. Excuse me. As a condition of CNCS and SIF funding, all programs and evaluations should be reviewed and approved by a Human Subjects Protection Board of good standing, meeting a sufficient standard of quality from CNCS. The review board may be unique to subgrantees within an intermediary, or they may be the different subgrantees from the same intermediary may use the same IRB. But ultimately, which IRB is going to be used is decided after a negotiation, I presume, between the intermediary, subgrantee, and the evaluation partner. When the SEP is approved, CNCS approves the location where the IRB submission will be made. And then the IRB review application process and approval is usually slated for the first year of the SIF project. Moving to the next, one potential IRB challenge that might emerge are using a new IRB for the first time. Each IRB is unique. Each has its own committee members, context, interests, areas of focus, and expertise. Having a limited network within the IRB, having limited experience or resources with an IRB, can both increase the challenge of applying for the first time to that specific IRB. There are lots of SIF program aspects, from study designs, informed consent, external reporting needs that may be new for SIF programs or evaluators. And so making sure that all of these aspects are appropriately and adequately addressed during the IRB application review can be a challenge and sometimes a source of surprises. Many SIF projects studies of vulnerable populations, and so this can necessitate a more extensive review from IRBs as well. Lastly, if or when SIF evaluation projects need to change due to various circumstances, it can be really difficult to know when to keep the IRB appraised of those changes so that they can reevaluate and then you stay in good standing as you renew from year to year to year your IRB approval. So what tips do we have for navigating IRB? I think communication across stakeholders with questions like, what are our IRB needs? What are the options for addressing those needs? What are different IRBs like? Who can we talk to, both about the IRB and with the IRB? I think being clear across all stakeholders what the IRB needs and concerns are is really important, because programmatic changes and evaluation studies might be necessary to accommodate IRB needs. But for instance, just on the program side, sign-up and enrollment in a program may ordinarily be done by a primary member of program staff, but now moving into a SIF project, you may have needs to and you may need to get informed consent, and those primary program staff may not have that necessary training, so you may have to change who does the initial intake for that program. If you have an option of which IRB to apply to, definitely select carefully, and again, find advocates and resources both within the IRB. Most IRBs will have front personnel who can answer questions, help you deal with issues, review paperwork before the committee reviews your application. I think that's really helpful too. In my work as a researcher, I generally have always had to take an online training in human resource, and that certification I received at the end of that training became part of the IRB application. So definitely think about means of getting as many staff and as many people preemptively trained as possible in those human subjects courses. I think that would be very useful, both to so that those people have the training that they need moving forward, but also I think it's a helpful thing to be able to tell the IRB all of our staff, all necessary staff, have received that training prior even to this application. I think when it comes to planning, it's definitely important to use SEPs to allot enough time and resources to the IRB process. We do realize that IRB issues can really derail an evaluation study's timeline substantially, and for that reason we emphasize it quite heavily in the SEP guidance and in our review of the SEPs. Of course, please let CNCS and JBS know if we can provide any guidance or resources about what might be necessary or helpful in getting IRB approval. Any questions before I move on to data collection?
Peter, you've got one from me up there in the chat, which says, can you talk just a little bit more about who needs to get training and approval for IRB data collection and informed consent?
Surely. So generally, I personally, I think anyone that's receiving or analyzing data, working with any raw data, they would need to receive IRB training and human subjects certification. Anyone that is directly collecting informed consent, I would say, would definitely need to be trained. And then anyone within the program that's collecting any data and running subjects through sort of interview processes, handling forms or delivering incentives, those would need to receive training. I think this is a really, really good question, and those are off the top of my head responses. We are working at JBS and with CNC on a in the webinar. We're developing an IRB tip sheet, and I think that's a really important aspect to include. And we'll keep everyone posted and hopefully let everyone know when we have that tip sheet, so I can more definitively answer that question moving forward.
And Peter, you've got one more IRB question in the chat, which said from Nathan Robertson, who says,
Yep.
I recently received questions from IRB institution. Is there a statutory requirement for IRB for SIF study, IRB approval for SIF studies?
I believe the answer to that question is yes, although I'll defer to Lily if a correction or elaboration would be necessary with that.
Lily, do you want to chime in? Because there is a functional, as I understand it, there's a functional requirement for IRB. It's sort of necessitated by what SIF is trying to do, but I don't know if it is a statutory, that is, it's laid out in the grant agreements or legislation anywhere.
Can you hear me?
Yes.
Okay, it is a requirement. I'm not sure if it's in the legislation. I think it's somewhere in the guidance and requirements, and I'm not sure exact location, but I know that that's been communicated, that IRB is a requirement.
The places that I have seen it in the NOFA, for example, I think I have seen it as to get appropriate IRB clearance as required, but I don't, if you want to type in a little bit more about what they're asking with regard to statutory, that might help clarify it. And if we don't know, we can certainly go back to the program and grants office and find out if the statutory part means more of a a agreements question than a functional question. I hope that helps somehow.
Peter, I was wondering if you could speak to the experiences that if IRB experiences within a particular area of research matters in terms of which IRB you select.
Definitely we've had some experience where people have, they have multiple evaluators or evaluations personnel and at a university, and so they've sort of made the decision, should we apply to a medical, you know, the IRB in the medical school as opposed to the College of Liberal Arts and Sciences. And definitely those two IRBs will have different standards and approaches, levels of expertise, and be able to make, you know, certain assumptions and reading between the lines in between those, you know, as they review a project. So that's definitely something to negotiate. Colleges, I know that I get the sense and the perception is that they are slightly easier to get through than medical IRBs, but that is purely a perception and a subjective judgment on that. Again, it's really, I think the variables that really come to play are the type of data you are collecting and from whom, and you know, those are going to be relatively inflexible, and if you're really looking to collect is kind of more socially derived, then there's a very good chance that even if you could potentially apply to a medical IRB, for one given reason or another, they'd probably throw you back to a College of Liberal Arts IRB anyway.
And Peter, you've got one more question here on the chat, which says, who provides the training?
My understanding is that there are various decentralized, so online available kind of courses and places you can set up to provide online training for IRB stuff. The one I've always gone through, and it's relatively well known in the circles I kind of roll around in, is CITI. So that's, you know, of the work I've done, I think people would instantly recognize that particular process and that certification. But I certainly don't think it's the only one, and I have no sense of whether or not it's better or worse in certain situations. But yeah, CITI is one to perhaps look at, and that's the kind of thing where the overarching organization pays a fee, and then and then sort of selects what kind of training it wants, who to receive, and then so everyone just goes online and sets up an account and goes through the certification training. Kind of like a lot of other human resource courses that you end up going on, harassment training and security training and that kind of stuff. That's for city. If you have a bigger sort of, maybe I don't know if this is true. I don't know if Mathematica or sort of larger evaluation firms, they may have procedures of their own means of doing those human subjects training and stuff that don't rely on those kind of decentralized, you know, city and those kind of online systems. They may have different ways too. So maybe somebody directly in the evaluator or directly in the program, or directly for the intermediary, if that. So it could be something directly that way. But my guess would be that it would just be an online training that people would receive.
Peter, I suggest we move on just so we can get through. You can get through the, you know, the slides, and then open it up for other questions.
Definitely. Sure. Thank you, Lily. Thanks for all those questions. Those are really helpful. So moving on to data collection then. A SIF evaluation project will entail a lot of data collection, very comprehensive. And some aspects of data collection may be new for some programs. Implementation data collection might be extensive, especially if you're referencing the friendly implementation study checklist included on the SIF knowledge network. The amount of baseline and demographic information, as well as the number and array of outcomes and impacts, that might be large, and it may be larger than in other evaluation projects that the program has employed. Lots of data has to be collected from a non-program group in most cases, and that may also involve an extensive and new operation. One aspect of data collection that we recommend for the non-program group is to know what services are being received by non-program participants that are similar or pertinent to those delivered by the program. So that may be a new thing or a resource requiring thing, aspect of the data collection. Last, collecting data beyond individual participants may be necessary because the unit of analysis is the school, site, or district level, and you may want to take care of confounds at that level. You may want to collect data indicating the context of the program activities and thus the generalizability of the study's findings to the wider population, say, at the state or national level. So what are some data collection challenges that might emerge? One is that data are being collected by many personnel, and there may be limited training or capacity of personnel. So in schools, data could be entered by school volunteers, SROs, administrators, and they may have limited capacity to collect or fully grasp the importance of accurate and complete data. When data are collected, the accessing, storage, and use of the data can also be problematic. Programs have mentioned problems just simply getting data sent over to them. And collecting, storing, and analyzing data in a secure way can be a challenge, especially if you have evaluators working remotely, if they're perhaps using graduate students. There are always questions and challenges in terms of how is it okay to transmit data? Is it okay to use thumb drives or store in Dropboxes and email accounts? And whose computer is it okay to put data on in terms of analysis? Also, just making sure that the data, again, to emphasize the comparison group, or control group, making sure the data collection is complete and comparable at non-program sites, especially if this is a new component to the evaluation for the program, can be especially challenging. So here's some tips for data collection. One, provide incentives, reminders, communications, whatever you can to improve the quality of answers that you receive from participants. This isn't something I highlighted on the previous slide, but I do think it's a good tip. Tracking and providing feedback about the quality of data, its accuracy in coding, as well as its completeness. And tracking and providing feedback to program and evaluation staff is really useful. At JBS, we found it useful to, over time, to provide feedback on data entry to school personnel who are organizing the data that we're using to conduct an evaluation. And when we find that when schools and teachers understand what the implications are for having poor and incomplete data, what the implications are for the report findings and the sort of the reliability or the faith that you can put in report findings. Once teachers and schools understand that, we found that the quality of the data that we receive subsequently improves greatly. Having clear agreements and procedures for using data, I think, are really helpful. Having someone at the school to ask after the data have been delivered has personally helped me solve problems and answer data that I have. So somebody delivers me the data, and then I have somebody to go back to when I have questions about it. There's nothing worse than being stuck when you've been delivered this data, and then you don't know what something means or how it's been coded or why it's incomplete or is only conditionally answered, and when you have nobody to ask what's going on, it can be a very disconcerting feeling because you know your evaluation report findings are going to be contingent on that understanding. And last, I just want to make a plug for using high-quality measures because I think they make data collection a lot easier. If a measurement procedure has a good set of instructions, can be done quickly, easily, and is perhaps enjoyable to administer and useful to just administer, I think the data that you'll get will be more complete, valid, and reliable. And in the SEP, we sort of communicate that understanding when we ask about the measure's history of use and its prevalence in the field. I think we're sort of looking for signs that if a measure is used often, then it's likely to be well tested, easy to use, as well as well validated. Any questions briefly before I move on to the last evaluation topic?
Peter, in case you can't see the chat, Monica Hayden asks, what do you mean measures, like surveys?
It could be a subset of questions on a survey. Like, for instance, a depression, you could use a depression scale or a set of items on a delinquency index. Things that I've used personally with my history and career in youth development. Those are two things I've used. But using preset series of questions, that's definitely useful thing to do. Those questions are usually very well boiled down, and the items are generally distinct from one another but connected in important ways. So you can just sort of go through. It's an easier way of going through. You know, if you have a set of questions that are very distinct and very user friendly, that's always helpful. It could also apply to classroom observations. At the University of Virginia, close to where I'm sitting now, they have a tool for evaluating teachers, just using observations and sort of using videotapes of the teacher teaching. And when those things are easy to use, and it's easy to get data out of them, that observational data, that's really handy. So those are the two things that I had specifically in mind, and definitely not limiting that to surveys. Definitely the more valid and reliable your measure are, and usually the sort of clearinghouses or federal agencies and stuff can put together compendia of measures that they think are particularly good, and those are really useful. I know I use one on bullying pretty regularly, so sort of all good measures about bullying and violence, and there's another one about sort of just youth development more generally. So that'll be attachment to parents, attachment to friends, you know, all that kind of good things. So these are measures that have been developed, tested, used, and should be easy and worthwhile inclusions to your surveys.
Thanks, Peter.
Yeah, of course. Hopefully that's helpful. Okay, so last I want to talk about secondary data. Specific to SIF, I think the reasons you would want to use secondary administrative data would be to you have extended means to meet supplement answering needs of all stakeholders. So your stakeholders may be university evaluators with grad students all the way through to school districts and ultimately CNCS and SIF. You can use secondary data to extend the data that you have and answer multiple questions that meet lots of people's needs. You may be able to test out additional portions of your logic model, particularly those on the right-hand aspects, such as outcomes and impacts, perhaps. Secondary or administrative data may provide better measures. They may be more focal for stakeholders, so high school completion, high school suspension rates, job retention, job acquisition, health clinic visits, and those measures may be more valid. So, for example, student reports of grades and suspensions may be less reliable and valid than the school records of grades and suspensions. So, the data may be more complete because they might not require collecting a ton of surveys and all those resources, and so that could be a benefit also. Most importantly, I think, as a principal concern, these data can come at relatively low cost compared to other means of data collection. So what are some of the challenges? A primary challenge that really sits on our radar are data agreements with schools, school districts, cities, and states. These are complex to establish. They take a lot of resources and professional capacity in some instances to just get established, and they often don't get carried out fully. Projects have definitely been left hanging when the data they were promised doesn't get delivered. I think experience and expertise while using some of these data are vital to accurate evaluation results, more so than I think a lot of people recognize. It can be a challenge to find personnel with sound knowledge and experience with how data were collected, how the data were managed, how the data were organized and structured, the history of that data collection. Some standardized tests can their means of collection or the scale on which they collect, the questions used, they can change over time. And it takes somebody to know those measures very, very well to be able to say you can or cannot use these data and these measures under certain situations. I think people that work and have expertise and experience can be very helpful in determining how much time accessing and analyzing data will take, and whether or not any changes to the program or evaluation study might be needed in order to fully integrate the secondary administrative data into the project. So my tips for secondary data are, 1, to plan and know what you're getting into when it comes to secondary administrative data. Plan for proper storage, security, access, integration of the external data with the other program and evaluation data. And make sure that all the relevant measures that you're going to use are included in the data that you can access. So some measures are only included in secure versions of a data set, and some measures aren't very good within the secondary data set, as well as, like I've just said, things can be better, but sometimes they can be worse as well. Pertaining to particularly to administrative data, I think it's useful to have a means of tracking, verifying data completeness and quality, and to have access to clear, comprehensive documentation and communications about the data. Ultimately, if you can't use the data, then your evaluation project will be restricted. Setting up agreements that you can trust down the road is going to be really helpful. They're immune as possible from capability shortages and leadership turnover on the part of the deliverer. The most successful navigation of administrative data issues, I think, have come from programs that have a larger number of sites and having multiple data agreements, and at least one of those data agreements held up to allow for a moderate level evaluation, or another situation where there were multiple measurements of outcomes. So there was survey data as well as administrative data, and when the administrative data fell through, the project was able to lean back on the survey data in order to complete their evaluation requirement. Okay.
Peter, if I may, I just wanted to add that you know, of course, this presentation or this webinar is one in a series of webinars, and Peter had already conducted one on secondary administrative data use. So if you would like to learn more about the secondary administrative data use and issues, challenges, and solutions to those, one suggestion is to tap into that former webinar that was conducted. Again, if you don't have access to that, you know, feel free to contact me, and I'd be happy to provide that information to you or send you the PowerPoint, and the recording is on the Knowledge Network. Just wanted to put that in.
Yeah, we covered some specific issues of using data as a comparison, and the sort of using secondary data. So that's a great suggestion. Thanks. Just moving quickly in the last few minutes, I just want to go through some reporting topics that keep coming. Is required at least annually, and a timeline for those reports is requested in the SEP guidance. It's always useful for the SEP to outline exactly what content the reports will contain as well. So there are annual reports, which will be which sort of give details of the ongoing status and the preliminary impacts of the evaluation project, as well as final reports, which will be a full self-standing report on the full evaluation project and its findings. And that report, that final report, will be disseminated across CIF and outside of CIF. We use it as a public document. So reports will cover aspects of implementation, program implementation, details of the evaluation study, any impacts, successes of the program, and then any lessons learned from the entire CIF process. Lessons learned from impact, implementation, being involved in the CIF may add some new aspects to the program. So then moving to the next slide. Some challenges that may emerge during reporting. Namely, the ones that we're sort of thinking about at the moment are when there are no significant findings or small effects. Reports may contain mixed findings, and these findings may perhaps emerge from the different aspects of the evaluation study. So the feasibility, implementation studies may have positive findings, the outcomes and then impacts may be less positive, or the other way around. The implementation of the program could have been really, lacked fidelity, and then the outcome results tend to all be positive. So there may be mixed results in that way too. There could be multiple outcome and impact measures, and not all results will be significant or of the same size across those different measures. And then results may not be consistent across different subgroups or program types. Lastly, the report may describe substantial changes to the evaluation study due to contextual factors that mean that the report is not able to address a sufficient number of threats to internal validity or has limited external validity. So intermediaries have asked us, how do you report these less than ideal circumstances? Okay. And so the tips that I have sort of about reporting, I think the first tip is to remember that CIF's focus is on promoting evaluation rigor and establishing and sort of getting quality information about the program. And it's not necessarily focused on establishing positive findings for all its programs. Rigorous designs like RCTs and matched quasi-experimental designs are specifically designed to reduce the number of significant findings because they reduce selection bias. So be sure to report all your findings and all the nitty-gritty technical details to allow CNCS to evaluate the level of evidence for the study and not just the positive findings and the positive aspects, the very positive aspects of the study design. Small or non-significant positive, possibly even negative impacts can indicate needs for program changes and improve the evaluation study. Maybe you need to use better measures, more extensive data collection, more effective counterfactual comparison. Mixed results can contextualize one another, provided that there are no negative impacts, and these should be specifically addressed in reports by themselves. But if you have no negative results, everything's positive, but some are non-significant, I think taking results on balance, taking the preponderance of results, is a perfectly acceptable approach to sort of discussing the program's impact in total. And another thing I want to stress is that CIF is really interested about knowing the lessons learned. Lessons learned about program implementation, the evaluation study, how that came about, what the operations were like, what were its successes in terms of just getting an evaluation study off the ground. How did CIF involvement affect all of those different operations? And so if this can always and should be a focus of the report, and could be done in conjunction with, but never superseded or covering over the program impact. One last specific and technical tips that I would perhaps offer is to report effect sizes. So these can suggest a program's effectiveness when there's low statistical power and effects might not be reliably detected. Effect sizes can also be used to discuss findings relative to those from other studies using different samples, different programs, or different measures. So perhaps the effect size you found was relatively high compared to other comparable programs, and a lack of statistical significance may relatively constitute more of a success in terms of the effect sizes as you compare them across different situations. So I'm sorry for leaving, like I said, leaving that slide on a technical note, and if I can provide any more information about effect sizes, please don't hesitate to let me know. So then, just as a conclusion slide, just a few general plugs for communication between the program officers and CNCS, as well as JBS. So feel free to contact your program officer with questions or concerns. And they can ask us for assistance with questions pertaining to the evaluation or even the program if we can help in this situation. Definitely feel free to share any updates you have about program operations or evaluation operations as they emerge, and include as many technical details and status updates as possible in the evaluation report. Please do feel free to let us know what we can do in addressing any potential challenges early and often. And so I've run into my time, but if anyone has any comments, thoughts, questions, please offer those up, and thank you so much.
Thank you, Peter. As you're sort of waiting to see if there are any questions, I just wanted to sort of make up for not being there in the beginning and just let everybody know that this is the first time that we've opened up these webinars to the, sub-grantees of the SIFT program and all the partners involved. So we're really delighted about that and hope that we can continue doing that in the future. And, let's see if we have any questions. I also wanted to mention that, we appreciate the feedback that you provide on this webinar so that the work can be improved going forward. And if you have topics of interest that you'd like to see covered in the webinars and the technical assistance materials that we offer, please feel free to suggest them either through email or through your feedback on the webinar. We appreciate that. Nicole, do you see any questions there?
I am currently seeing no questions, no new questions in my chat box. If you do have questions, please feel free to either raise your hand so that Jerry Ann can unmute you, or just type a chat question and I will read it out loud for everyone to hear. And seeing no additional questions, I would like to just chime in with my own thanks to everybody for joining us on this today. We appreciate so many people turning out to listen to us, and we do hope that this has been helpful. However, like Lily said, if there's anything we can do to make this more helpful, or there are future topics you'd like to see covered in the future, please do let us know through the survey that's going to come up shortly. Peter or Jerry Ann, any other closing comments?
No, just to reiterate, thank you so much. Please let us know what we can do to help moving forward.
Thank you, Peter. Thank you. Go ahead.
That concludes the session then. When we exit WebEx, your browser will take you directly to the survey where you can give us feedback on this session as well as suggest topics for future sessions. So with that, I will end the